frontal bone. You can see the supraorbital margin and the supraorbital foramen next to those. Okay. Looking on the inside, once we look inside here, you can see get a good picture of this here. Okay, there's the optic foramen, the hole right there. Then we have a superior orbital fissure on top and an inferior orbital fissure on the bottom. This is essentially my sphenoid bone that you can see from in here. All right, nasal bones up front here. All right, and then we look inside the nasal cavity. You can see dividing into the right and left sides is the nasal septum. The inferior portion of the nasal septum is made up of the vomer. The superior portion up on top, which is kind of broken apart here, is going to be the perpendicular plate of the ethmoid. Okay, to the sides here, you can see the inferior nasal congi bones, which are their own facial bones, and a little higher up here, so we can see that. So here on the left, you can only see we may have to change that, okay, because this one's broken off. So there's the inferior nasal congi. We'll change that up. This is the middle when I look at it from the front. All right, these are the middle, which are actually part of the ethmoid bone. Okay. All right, we have the lacrimal bone here with the lacrimal fossa on the inside portion right there. So those are the lacrimal bones. These little ridges are part of the alveolar processes of the maxillary bone. All right, you have the infraorbital foramen, part of the maxillary bone again. These are the zygomatic bones, our cheekbones. Okay. Looking closely at that zygomatic bone, if you can zoom into that, up to this little suture line here, this part right here is the temporal process of the zygomatic bone. Right there. The whole thing is the zygomatic arch. So this portion from the suture backward is the actual zygomatic process of the temporal bone. Okay. And then we'll go back to the front here again, okay, back to the maxillary bone, and then we're going to go down to the mandible. So look at the mandible. We have the alveolar processes of the mandible as well. You have the mental foramen of the mandible with the body of the mandible here. Up to this point, right here, we have the angle of the mandible. All right. We have the mandibular condyles, or the condylar processes here, and the coronoid process of the mandible there. This is the ramus of the mandible, and this is the mandibular notch right there. Okay. That mandible is going to sit in, if I can pull this apart a little bit, it's a pretty tight spring. So that condyle is going to sit in the mandibular fossa of the temporal bone. All right. The articular tubercle sits up here in front. All right. Then continue on with our temporal bone here. We have the external auditory meatus. All right. And we have the mastoid process. All right. On this side, we can see the one that's broken off this one, but this is the styloid process of the temporal bone there. All right. And then underneath, and I probably need a pipe cleaner to get that at the very tip of this stick, you can see that hole there, which is the stylomastoid foramen. All right. So now going to the view from, let's go to stay on the side here, and I'll take the skull off before it falls off. Okay, external auditory meatus, mastoid process. We go to the back side underneath here. Now we have our occipital bone. All right, and I'm going to flip it back here real quickly. The nuchal lines are not very visible, so there's a superior and an inferior nuchal line here. Those are not anything we want to really worry about too much, but this bump on the back is the external occipital protuberance. All right. If you go underneath, you can see the foramen magnum. These little things here are the occipital condyles, which are going to sit on C1 and allow for flexion and extension of our head. All right. Looking from underneath here, we're going to go anterior to the hard palate here. The posterior portion, you can see that little suture line right there. The posterior portion of the hard palate is made up of the palatine bone. The anterior portion is the maxillary bone again. And up in the very front, you can see that foramen called the incisive foramen of the maxillary bone. So it's right behind our incisors. All right. Also back here, I think I'm going to use the pipe cleaner in just a second for this. So let's look at it here. These are actually the pterygoid processes of the sphenoid bone that you can see right there. All right. Looking at it from here, we can see the carotid foramen there. So these are the carotids, these are the jugular foramen behind, and the jugular foramen, I can pass the pipe cleaner all the way through the jugular foramen there, okay? We have a couple other foramen here that you can see, the spinosum and the ovale. We're not going to worry about them too much from this view here because we'll look at them from up on top in just a minute. All right, so we'll turn this, and now we're going to look at the internal view, okay? So up here we have our ethmoid bone. This is the crista galli. A little further down is the cribiform plate on each side, and the little holes in the cribiform plate are the olfactory foramina. Okay, you can see the sphenoid bone here, and we can see the lesser wings up here. The greater wings go down to these little suture lines here. So these are the greater wings on the bottom. This is the sella turcica that holds the pituitary gland. All right, and then we can also see as we come through from the front that you're going to see the optic foramen come through here. All right, so if I pass this through the optic foramen, if I can get through it there, I'll try this. Okay, you can see where this optic foramen comes out here in the sphenoid bone. Okay, all right. So we'll continue on with that, back to the inside. So now we have some foramen here we have to name. We have the foramen rotundum right there. Work better with the pipe cleaner? Okay, so foramen rotundum. You can cut out anything you want as we go through that. This is the foramen ovale. That's the foramen spinosum right there. And then this is the foramen lacerum on the side. That's the way it would be labeled on the exam in that order. Okay? So rotundum, ovale, spinosum, lacerum. Okay? You can actually see the extra internal auditory canal or internal auditory meatus off to the side there, and the jugular foramen come through here. So you can't see the carotid very well from here. So these are the jugular foramen on each side. Right there. Okay? Foramen magnum from the inside view. Okay? And then looking down, if you look through there, I'm going to pass this from underneath, you can see, okay, the hypoglossal canal. All right, coming through the foramen magnum. All right. The mandibular foramen on the inside are kind of difficult to see on this model, so they're actually covered up in here. If I take, I need a pause here. Where's that old?